So a lot of the talk right now is about those variants quickly spreading across the province. Leading health experts saying that Ontario is now in a third wave. A lot to talk about. Joining me now on the province's battle against COVID-19, infectious disease expert and member of Ontario's vaccine task force. Good morning, Dr. Bogoch. It's been a while.
Good morning. Good to see you again.
Nice to see you. All right, so let's get right to it. The idea of us being in a third wave, there are still varying answers depending on who you speak to, but when you look at the data, it seems fairly clear. Where do you stand on it?
Yeah, I love how you explained it. I mean, we can call it whatever we want, but if you look at the actual numbers, the cases are going up. It's not a blip. It's a real trend in the upward direction. If you look at, I don't like the day-to-day case counts because there's some variability. So you look at a metric like the 7-day average. And if you look at the 7-day average of daily cases from the beginning of the month, it was about 1,000 new cases per day. If you look at the 7-day average now, it's about 1,300 new cases per day. That's a jump. That's a big jump. That's sustained over time. Cases are truly going up. You can call it a wave. You can call it whatever you want, but the cases are going up.
Indeed. And when we talk about the variants, these are obviously variants of concern. You tweeted yesterday about AstraZeneca and its efficacy. We're looking at the UK variants and that it's showing AstraZeneca's vaccine does well against this one. What about the South Africa variant, which we're seeing more of?
Yeah, so there was some data emerging from South Africa that demonstrated that the AstraZeneca vaccine probably isn't the best vaccine to combat the variant of concern that was initially discovered in South Africa. Okay, fine. When we look at what we have in Canada, by far and away, the most common variant of concern is the one that was initially discovered in the United Kingdom. That's the B.1.1.7 variant. And the AstraZeneca vaccine really works well against that. I think that if you're in Canada and you're offered a vaccine, all of the vaccines that we have available to us, either AstraZeneca, Pfizer, Moderna, soon to be Johnson & Johnson, they all will help you here. They will all reduce your risk of getting this infection and of preventing severe infection, hospitalization, and death. They're all very good options. And I mean, I really hope that people take the vaccine that they are offered when it becomes offered and when it's available to them.
Dr. Bogoch, you hear the idea of people doing these, vaccine shopping, almost holding out and saying, listen, I don't feel confident in the AstraZeneca vaccine, specifically because of what we've seen in various European nations, but that has since changed. When you hear people holding out and being hesitant to take a certain type of vaccine, what is your message to them?
I think we just have to remember where we are right now in Canada, and this truly is a public health emergency. It is. I mean, we're seeing about 1,300 to 1,400 new cases per day in Ontario. We know who gets infected, where they get infected, and how they get infected. We know people age 60 and up are at very high risk of having complications, including hospitalization and death. And we also know that any of these vaccines that are available to us in Canada work very, very well in clinical trials and also in with real world data. So I would really hope that people would take the first vaccine that's available to them. And the other thing to remember, too, is that this isn't the last vaccine you're going to get. Let's say you get a Moderna or a Pfizer or an AstraZeneca. Great, you're protected. This will certainly help you, and the protection starts 2 weeks after your first dose of the vaccine. You still need 2 doses, but your protection starts 2 weeks after the first dose of your vaccine. But remember, later on, months and months and months down the line, we're all going to need a booster vaccine. We're all going to need an updated vaccine for the variants of concern. And we'll probably be at a point at that point in time where we'll say, you know what? This group, because of age or underlying medical condition, should get this vaccine. That group, because of other factors, should get that vaccine. But currently, if you're over the age of 60, any of these vaccines will be extremely helpful for you.
What about our younger population? Obviously, news of Moderna starting trials both in Canada and the U.S., 12 and under. Is this encouraging news?
Oh, it's incredible. So the Moderna trial is going to look at the safety and efficacy of the vaccine from those who are aged 6 months to 12 years. But the other interesting thing is they have trials underway. Several companies have trials underway looking at vaccine from age 12 years to 16 years. And we'll probably have that data available to us in the summer. So we might see vaccines going into school-age children, perhaps, just a guess, maybe before the school year starts. And of course, we'll have availability for an even younger cohort later on. It's just important. If we want to get this infection under control, we really need to be able to vaccinate the community at large, and this will give us the data that will hopefully support that.
Absolutely. A lot of good information here. Dr. Isaac Bogoch, always appreciate your time. Thank you.
Have a great day.
You too. 7-Eleven is what we're sitting at right now. We joined the gang. We're traveling to Ottawa. Hey, guys.